Now let's switch our attention to another story and living with a disease that is said to permanently suppress one's immune system at a time when the global pandemic, COVID-19, is at its striking best is a heart-wrenching ordeal for HIV and AIDS patients. For this reason, thousands of these patients have refused to go to health facilities for their regular antiretroviral therapy and treatments for fear of contracting another immune-attacking virus. In this report, Evelyn Arba Edu engages persons living with HIV and AIDS who say, apart from the stigma and discrimination, they are devastated with the presence of COVID-19.
The decision to attend HIV and AIDS treatment comes at a time of uncertainty, especially for people with a weak immune system. This is because they risk severe COVID-19 infection. Meet Essie Nkrabea, as I choose to call her. She's one of the 346,000 people who are living with HIV and AIDS in Ghana. The 47-year-old has been living with the disease for 22 years. Essie is a mother of 5, but only 3 of her children are alive, as the other 2 died from the disease, just as her husband, who infected her with a deadly virus. To say life has been challenging in the last 2 decades, coupled with stigma, discrimination, and rejection even during labor, is an understatement.
Because of my status, and the stigma was very high, and that time the nurses was not attending to me at all. So I delivered myself bare floor. One nurse attend to me and do the cord for me. She didn't even ask whether I'm on medication or there is anything that they can do for the baby.
But the emergence of COVID-19 in the country has compounded her woes. Essie tells me that over 500 other persons who were also under the antiretroviral therapy have all stopped since the outbreak of the COVID-19 pandemic.
I didn't come to the facility at all, but because it attacks the immunity, I was afraid that even going to the market to buy something was a headache for me. And I was also thinking about my children. 2 people called me crying that they have tested positive and that they have sent them to where they send people, and the treatment center, and as they don't know what to do, it's a big challenge to them.
For 24-year-old Akwesi, not his real name, living with AIDS for 3 years has been daunting, especially during the partial lockdown. He disclosed that the shutdown of the borders led to a shortage of antiretroviral drugs, which led to them receiving antiretroviral drugs and treatment for 2 weeks instead of the regular 3 months.
Your immune system is compromised already as a positive client, and we wouldn't want to go out like trying to go to the facility for treatment and then end up getting COVID as well. When I go to the facility, we don't get the meds because there was a shortage. We had a shortage for like 6 months. So at a point in time when you come, instead of the normal 3 months that they give you like 2 weeks or 1 month, and then they'll ask you to go and come again.
Essie and Akwesi are not alone in this, as 31-year-old Kweku shared with me his ordeal in the wake of the COVID-19 pandemic.
Because of stigma and discrimination, we don't want to go to facilities closer to us. With the lockdown issues, you have to get a permission for transportation, for moving out of the city to another city and all those things. So it wasn't easy. That time that I'm not on treatment, like not having any medication, all I did was eating well, trying to avoid stress, doing things to boost my immune system. okay, to sustain me till the lockdown is over.
But the Director General of the Ghana AIDS Commission has been explaining what led to the shortage of the ART and why a significant number of patients have fallen off the treatment.
COVID had impact on the supply chain system so far as HIV commodities are concerned. Because the stock levels had not been increased at that time, within a short time, stock levels reduced significantly. A number of shipments had also come in, but we had a challenge with clearing of those commodities. They stayed at the port for a very long time, and so by August, September, around this time, there was crisis.
Dr. Kofi Odoye-Labi is at the West African AIDS Foundation, and he tells me that most patients were affected by the pandemic. He disclosed that the facility had to put in more resources to deliver drugs to some patients.
I can't quantify, but quite a significant amount of them were now not coming. It was when we put the measures in that helped a bit, but yes, we were affected to some extent for the first few months. One of the things too that we did was that we tried to ration the medication now, because sometimes we give 5 months, sometimes 4 months. So we decided to start giving everybody 3 months, 3 months, 3 months, so that everyone could get some of the medication.
For Priscilla Efum, who is a nurse, her task doubled as she had to take the medications to some of the patients at their homes.
And the shortage was recorded as nationally that there's shortage of ARVs. When people call you that they need medicine, but then due to the lockdown or because of the COVID, some also lost their jobs, then you have to carry the medicine and then go to their various houses or destination that will be comfortable to give the medicine to them. And when it comes with that, it puts a burden on you as a nurse.
There is currently no evidence that people living with HIV and AIDS have any greater risk of acquiring COVID-19, but there is concern that a COVID-19 infection could be more severe for people living with HIV and AIDS who are not taking antiretroviral therapy.
Evelyn Araba Edu, reporting for GH1 News.